The important thing we try to emphasize here is that patients don't care how much you know until they know how much you care.
I had this day when I was training as a resident that I'll never forget. In the course of a 24-hour period, I helped deliver a baby. I took care of somebody in the ICU at the end of their life. It basically grabbed me. It's like, what could you do to be part of this?
We try to treat the entire person. We look at their body, mind, and spirit, and you want to assess all of those needs. When I see a patient and I help them, it's really unexplainable. There's so much involved in that person's life that touches a part of their health, and then I get to follow them long term and see them throughout the years, and then eventually see their children as they grow up. It's a wonderful thing.
OSU Medicine, it allows you to tailor your patient visits. It's not this cookie cutter medicine where everything's regimented into a certain time and you have to fit your patient into that spot. That patient-doctor trust relationship has to be brought back to the forefront of medicine. I'm very passionate about that.
That's one thing I like about the doctors at OSU. They take the time to sit with that patient, and we see them through the whole process of getting better. And you call them and they know your name, so they become kind of part of your family.
When we walk into a room and we have a patient sitting there, we see the person, not the disease sitting in the room with us. It's key to understanding what's going on with your patient and seeking to help them become the best and most healthy version of them that they can be.
They don't come in and just treat the symptom. They treat the body. You go in there and just have a heart problem and have something else serious going on, and nobody's looking. And I like that. I like the personal side of it.
It's really not a feeling that I get seeing someone recover and get better. It's more of a realization that it's a privilege to do what I do, provide a healing touch in some way to help patients get better. That touch is an initial beginning to the whole relationship with the patient.
People actually derive a benefit from being listened to, interacting with a caring physician.
My son Jackson was diagnosed with medulloblastoma. We went to the ER thinking maybe it was just kind of like the flu. So it was very shocking to find out that we did have cancer. And so it just started our long journey. But they were always there with you.
I was a little scared. And at first I was like, okay, he's just another doctor, and then he's become more than that. He just would be there for me every step of the way. He barely went home. I would just describe him as magnificent, great, and irreplaceable.
So our emphasis is really put back into having one-on-one contact with that patient, making sure they understand the comfort and compassion from a physician. Computers these days have really taken that away, that relationship from the patient to the physician. So we've tried to bring that back. We're gonna have that relationship for 30 years or whatever it takes.
We have many primary care services as well as specialty services, family medicine, pediatrics, obstetrics and gynecology, internal medicine, general surgery, and psychiatry are kind of what we consider to be our primary care services. We also have orthopedics, cardiology, cardiovascular surgery. So patients can receive care at every stage of their life at OSU Medicine because from the very beginning, a pregnant mother can seek care at OSU, take that baby to pediatrics. Her family can receive preventative health services through family medicine, but then we have specialties that are there. So there's a variety of services that are provided through OSU Medicine. We have clinics located in North Tulsa, in South Tulsa, East Tulsa, West Tulsa, and downtown. So having clinics across Tulsa helps our community access healthcare close to home.
We want to make a change, so we want to work with people about their primary care needs and healthcare maintenance and stop disease processes before they start. We'd rather them not have hypertension or diabetes or obesity, we'd like to talk to them and counsel them and see them and work on their health maintenance issues before that.
With OSU Medicine, what better investment can we make than our talents, our knowledge, our skills to the next generation and to the community?
You can save people with the right tools and the right resources that we have at OSU.
When Dr. Cook came in, she was so caring and so not really doctorish. And I said, well, I understood I had that spontaneous coronary artery dissection. And she said, oh, you didn't have a dissection, you had a shred, but you're fine. We got you all fixed up. She was just very, very genuine. I don't think I can say enough about her, and I would recommend her to anybody in a heartbeat, or a heartbeat.
Above and beyond, for me, goes back to the mission of the reach of OSU. The fact that we're actually looking to create well-rounded physicians, primarily in the primary care setting, that are ready to go out and solve the problems and really help patients out.
Going above and beyond for Oklahoma.